Well, come on in and find a seat. Thank you so much for coming today. This is being offered as part of our efforts for education related to Title IX, which is sexual harassment, discrimination, and bias, as well as our efforts around racial, ethnic, gender, disability, veteran status, any other kind of discrimination, bias, and harassment. So that's part of this, but the other part of it is even in the regular day-to-day interactions with colleagues, with students, maybe even family members and friends, we could be encountering a person who has experienced some kind of trauma or is currently in trauma. So this workshop has lots of applications. We're going to post the video link. I'll send it in an email to the faculty and staff email lists, and then Sarah has agreed to share her PowerPoint, so I'll attach that as well to that email to faculty and staff. But I just want to say thank you for coming. This isn't required, but I'm really glad that you're here. Every time I listen to something like this, I learn something new, and as many times as I've been through it, I'm just grateful that there are experts like Sarah who practice and teach topics like trauma-informed care all the time. So let me offer a word of prayer, and then I'll introduce Sarah and turn it over to her. Lord, thank you for the opportunity that we have here at Westmont to participate in the work that you are doing. I do pray for our community, particularly for those who have experienced some kind of trauma. Lord, I pray that this hour would be one in which we learn information for sure, but even more than that, that you would transform our hearts, help us to be sensitive, increase our capacity to love other people as you, Jesus, ask us to. I pray for Sarah. Thank you for her expertise. I ask that you would let her words and her expertise land with us in a way that we can really help our students and our colleagues and even our families and friends. I pray this in Jesus' name. Amen. Sarah and I started the same year at Westmont, so this is our 10th year together. Sarah's chair of the sociology department, and she also has a number of other administrative responsibilities, academic senate and various other things, and she continues to teach her sociology classes. One of the things that I really value about Sarah is, and I mentioned this, is her ability not just to instruct and teach, but to do what she says. In my role as Vice President for Student Life, sometimes I will hear from students, I was talking to Dr. Jirek, and then they fill in whatever it was. And the sense that I get from students is that Sarah is a very trusted faculty member, someone with whom students feel very safe, and that tells me that she's practicing her skills and using her expertise. So we are very fortunate, Sarah, to have you in our community, helping our students, but also helping us. Thank you for doing this today, and let's welcome Sarah Jirek.
Thank you for that warm introduction, Edie. I appreciate it. And welcome, everyone. So thank you for coming. For those of you who don't know me, as you just heard, my name is Sarah Jirek. I'm an associate professor of sociology here at Westmont. I have a master's degree in social work, as well as a joint PhD in social work and sociology. My specialties are in gendered violence, trauma recovery, and post-traumatic growth. The majority of my clinical work has entailed working with survivors of domestic violence and sexual assault, as well as in crisis response. I also research how nonprofit organizations can more effectively prevent or reduce vicarious trauma among their staff members. So like many of you in this room, I have had numerous experiences over the years in my work with college students when a student will stay after class or come to my office hours and disclose some type of trauma or other adversity that they're currently facing or have experienced in the past. Since I teach classes specifically on interpersonal violence and an introduction to the helping professions, these conversations are often sparked by class readings, discussions, or videos that are particularly poignant because the students have personal experiences with the subject. Sometimes students are in acute distress due to a recent trauma or trigger. The purpose of this workshop is to equip members of the Westmont community, Title IX report recipients, administrators, faculty, residence life staff, coaches, supervisors, and more, with the knowledge and skills needed to respond appropriately and effectively to trauma survivors within our community, particularly when students disclose some aspect of their traumatic experience to you. So what are we trying to accomplish today? Specifically, by the end of this workshop, my hope is that you will be able to do the following. First, explain what trauma is and its effects upon survivors. Second, be able to discuss, or at least recognize, the 6 guiding principles of trauma-informed care. Third, enact several key do's and don'ts when it comes to responding to students' trauma disclosures. Fourth, understand what steps you should take after a student's trauma disclosure. And finally, identify several actions that you can take to reduce your risk of vicarious trauma and enhance your well-being. In past decades, trauma was typically viewed as something unusual and relatively rare. More recently, however, there's a growing awareness that trauma is best thought of as a normative experience that most of us encounter during our lifetimes, and often more than once. Adverse childhood experiences, also called ACEs or ACEs, are potentially traumatic events that occur in childhood. ACEs include such experiences as violence, abuse, growing up in a family with mental health or substance use problems. According to a widely publicized study from 2018 on the prevalence of ACEs or ACEs, 61% of adults had at least one adverse childhood experience, and 16% had 4 or more of these types of ACEs. Women and several racial and ethnic minority groups were at even greater risk for experiencing 4 or more ACEs. A multi-decade longitudinal study, also published in 2018, similarly found that the majority of children, 60% in fact, experience at least one trauma by the age of 16, while over 30% are exposed to multiple traumatic events. So given these high prevalence rates, again, the majority of children, 60% experiencing at least one trauma by age 16, and almost a third being exposed to multiple traumatic events, it is likely that the majority of us in this room have experienced trauma ourselves, and that we work on a regular basis with students and fellow colleagues who have also experienced at least one and possibly multiple types of trauma. As I will outline a bit later in this presentation, traumatic experiences can substantially impact every area of life. Regardless of your role here at Westmont, it is possible, if not likely, that you will observe the effects of trauma in students, and that, on occasion, students may choose to tell you about their traumatic experiences. So, to respond well to trauma, we first need to have a basic understanding of trauma and its many effects. So there are decades of research on trauma, and those studies have yielded myriad definitions. Today, however, I will be drawing from the definition proposed by SAMHSA, that is the Substance Abuse and Mental Health Services Administration. So, quote, individual trauma results from an event, series of events, or set of circumstances that is experienced by an individual as physically or emotionally harmful or life-threatening, and that has lasting adverse effects on the individual's functioning and mental, physical, social, emotional, or spiritual well-being. I have underlined 3 parts of this, and I'm going to talk about those further. So first, with regard to trauma, there's first an event or a circumstance. This could be a one-time occurrence. Could be something like a major car accident, a natural disaster, a sexual assault, the death of a loved one. But it also could be a recurring experience, such as child abuse or neglect, growing up in a household with domestic violence, or being bullied by one's peers. Second, notice that it's important how an event or circumstance is experienced by the individual. So that is how they label it, how they make sense of it, the meaning they assign to it, the degree to which it disrupts their lives physically, psychologically, spiritually. All of that contributes to whether or not it's experienced as traumatic. So in other words, something that may be experienced as traumatic for one person may not be experienced as traumatic for another. Moreover, an individual's perception of and response to a potentially traumatic event is shaped by numerous factors. Some of these include family upbringing, developmental stage, personality, temperament, cultural beliefs, religious beliefs, social support, and so on. Now, research on trauma has demonstrated that events that involve interpersonal violence, betrayal, humiliation, or silencing increase the chances that an experience will be traumatic to the individual. So now we're to that third underlined word, the negative effects. So the negative effects of trauma may be immediate or delayed, short-term or long-term, a combination of all of the above, and they can impact every area of life. So our students may therefore exhibit trauma symptoms for and disclose to you about childhood experiences that occurred years ago, but the impact of which is only beginning to be worked through now. For an example, a student once disclosed to me her experiences of being molested during her middle school years. She'd had a lot of therapy around this. She thought that she had it dealt with. It was in the past tense for her. But one of her assailants committed suicide during her college years. And when she learned about it, she began experiencing trauma symptoms again. It is important to mention also that there's a growing awareness that not all trauma is individual trauma. You know, there have been lots of events recently in the news. If you think about Hawaii and the fires there, if we think about the major natural disasters that have been in the news, trauma can also be experienced, for example, collectively. Trauma can also result from structural violence, which occurs when discriminatory social arrangements and societal inequalities have negative effects upon disadvantaged social groups. This includes things like denying a minority group's access to education, healthcare, civic engagement, housing, and a host of other social justice issues. Like I mentioned, collective traumas can occur, historical traumas, intergenerational traumas are also part of this larger trauma concept. So regarding the effects of trauma, there is an incredible body of research on the myriad effects. Trauma can be particularly damaging when it occurs during childhood and adolescence. So let's take a look at some of those negative effects. So a body of research on early trauma, or ACEs, demonstrates the correlations you see on this slide. So starting on the adverse childhood experiences on the left, adverse childhood experiences may actually disrupt or alter the development of the brain. So then this can lead to social, emotional, and cognitive impairment. It can impact one's ability to cope with the normal stresses and strains of daily living, to trust others, form meaningful relationships. It can impact the capacity to regulate one's behavior and manage one's emotions. It can result in lowered self-esteem, an increased sense of vulnerability, and disruptions in cognitive processes related to memory, attention, and concentration. So all of those social, emotional, cognitive impairments can then lead to adoption of health risk behaviors. So some of those include drug use, self-harm, risky sexual behaviors, and more. Those types of behaviors can lead to disease, disability, and other problems. So examples of this, there's correlations with lung disease, liver disease, heart disease, autoimmune diseases, digestive illnesses, cancer, diabetes, sleep disturbances, chronic depression, generalized anxiety, and serious mental illness, as well as kind of social problems, problems at school, the perpetration of violence, encounters with the criminal justice system, major financial problems, and serious job problems. And then lastly, the combined effects of trauma have been linked with lower life expectancy. Now, I know these are heavy topics. So while it is important for us to realize that trauma can substantially impact every area of a survivor's life, it is equally important to remember that trauma does not determine our fate. These are correlations. That is, elevated risks based upon past social science research. They are not destiny. They are not foregone conclusions. Every person has the capacity to overcome hardships and adversity. You have likely overcome many hardships and adversities yourselves. As someone who's worked with hundreds of trauma survivors, I find it really encouraging to know that people can successfully recover from trauma, that human beings are incredibly resilient, and that trauma can spark positive changes in people's lives, such as post-traumatic growth. Some of the most common forms of post-traumatic growth, one of the topics I study, include a greater appreciation of life and a changed sense of priorities, warmer and more intimate relationships with others, a greater sense of personal strength, recognition of new possibilities or paths for one's life, and spiritual development. So the next topic we're going to focus on is the concept of trauma-informed care, the name of this workshop. Now, you might be thinking that working with trauma survivors is just outside of your field of expertise, or far afield from your particular role here at the college. If so, it's important for us to make a distinction right now between trauma-specific care and trauma-informed care. So trauma-specific care, over here, is performed by experts and professionals. They're trained in trauma therapy. They use specific therapeutic modalities. They treat specific trauma symptoms. Those are experts in working with trauma survivors. That's not what this workshop is about. So rather, trauma-informed care is something that all of us should be well-versed in. It involves having a basic understanding and awareness of what trauma is, how incredibly prevalent it is, and the many ways it may impact the people we work with, including our students. You do not have to be a therapist to be therapeutic in your interactions with others. I find that really encouraging, that the various ways we interact with people, especially in the framework of a trauma-informed approach to our interactions, can be therapeutic to the people we interact with. So a trauma-informed approach is guided by 4 assumptions, known as the 4 R's. So first, we must realize how common trauma is, and how high the likelihood that many of the people we're interacting with on a regular basis on this campus and in other parts of our lives have been impacted by trauma. In general, we should assume that when talking with students, even colleagues, that many, or even a majority of them are trauma survivors. The second of the 4 R's is recognizing. We need to recognize the signs and symptoms of trauma. Third is our response. We need to respond appropriately and therapeutically to trauma survivors, and we'll talk about that more very soon. And lastly, we need to resist re-traumatization. So to do that, we need to be aware of survivors' feelings of disempowerment when we're interacting with them, helping survivors to restore a sense of safety, power, and self-worth. Now, in addition to the 4 R's, SAMHSA has outlined 6 principles of trauma-informed care. And these have to be implemented at an organizational level, like college-wide, as well as in individual interactions. So the first of these 6 principles of trauma-informed care is safety. In a trauma-informed organization, every member of the organization works to create an environment in which students and colleagues feel physically and psychologically safe. Second, regarding trustworthiness and transparency, we must take steps institutionally, individually, to build and maintain trust with trauma survivors. This involves clearly outlining our expectations, providing rationales for policies and actions wherever possible, and building positive and authentic relationships. Third, peer support. Whenever possible, facilitate connections between trauma survivors. These relationships can be a powerful means through which to instill hope and promote healing. Fourth, trauma-informed organizations foster collaboration and mutuality by sharing power and decision-making, and recognizing that everyone has a role to play in developing a therapeutic culture on our campus. Fifth, the principle of empowerment, voice, and choice reminds us to listen to survivors, help them to rebuild a sense of control and autonomy, provide them with opportunities to make decisions, and promote their participation in the creation of goals. A key point here is to do with rather than do for trauma survivors, wherever possible. Finally, a trauma-informed organization pays attention to cultural, historical, and gender issues. This entails developing cultural competence and respect for diversity, actively moving past stereotypes and biases, offering culturally responsive policies and services, and recognizing and addressing historical trauma. So now we're going to shift our attention toward how to implement the things we're learning today in actual interactions with students. So research on trauma recovery clearly demonstrates that talking about traumatic experiences can be therapeutic and may help survivors in their recovery and healing processes, even if the listener is not a therapist. Each of us, by actively listening to trauma survivors, can enhance the therapeutic healing processes of the survivor. We are not asking you today to provide trauma-specific care. That's performed by experts trained in trauma therapy. However, trauma-informed care can make a major difference in students' lives. So in this section of the workshop, we're going to get practical. We're going to explore practical tips, as well as several key do's and some don'ts when it comes to responding to students' trauma disclosures. So unless you are brand new to working with students, it is likely that students have previously opened up to you regarding trauma or other adversity that they've experienced or are currently experiencing. It is completely normal and understandable if in those kinds of moments you might have felt anxious, uncomfortable, intimidated, or unsure how to proceed. The good news is that responding to trauma well and those disclosures, it's a skill that can be developed and strengthened over time. An important thing to keep in mind in those kinds of moments is that the trauma survivor is taking a risk in confiding in you. She or he is likely feeling myriad emotions, which may include feelings of shame, guilt, powerlessness, betrayal, confusion, isolation, vulnerability, maybe a fear of not being believed, a fear of being blamed, fear of stigma, and if applicable, a fear of the perpetrator, fear of the ramifications of disclosing, and probably other feelings as well. So I find it helpful in these moments to think of trauma disclosures as sacred moments, where a beloved child of God is reaching out for support, and in which God can use all of us to channel a bit of God's love and compassion into someone's life. In terms of some key do's and don'ts, these tips are going to build upon characteristics and skills that you likely already have as Christians, as kind and loving and giving people who feel called to work at a place like Westmont College. You have likely already employed many of these skills and characteristics in your friendships, your family life, and your work. So here are a few practical do's. When you're with a trauma survivor, do practice good listening skills. So this includes like facial expressions, gestures, eye contact, body language that reassures someone that you're really, truly listening to them and listening well. Do notify students early in the disclosure encounter regarding your role as a report recipient for Title IX related behaviors, bias, harassment, and discrimination if applicable. Do be patient, empathetic, encouraging, and validating. Do communicate care, concern, and support. Do explain any steps you plan to take and why, asking permission wherever possible. Do convey your availability and willingness to be a source of support. Do be familiar with available on-campus resources. These include things like the Health Center, Counseling and Psychological Services, CAPS, the Center for Student Success, Residence Life, Student Life, and more. Do maintain good boundaries. For example, being clear about your role and its limits, and making appropriate referrals to other on-campus resources. And do check in with the student regularly following the disclosure. In terms of what not to do, here's just a few to keep in mind. Do not interrupt the student's narrative of what they've been through, at least not too much, with the important exception of letting them know early on about your reporting responsibilities. Do not force the conversation. If the student does not seem to be ready to disclose, don't push it. Just make it clear that you're available to talk if they'd like to do so at a later time. Do not be judgmental. Even if you think the student may have made some unwise decisions, do not be judgmental. Do not make assumptions either. Simply ask clarifying questions at the end if needed. And lastly, do not make promises that you just can't keep. So for example, don't promise that you're going to be available 24/7, 365 to talk to. Don't promise that God will bring about a specific outcome in their life in these circumstances. Now, if the thought of student trauma disclosures still leaves you feeling uncertain regarding what to say, I'm going to give you a few examples. So we're going to pretend that this up here is my office, that a student has just shared some of the details of a trauma that is impacting them. Could be something like a sexual assault, the death of a family member, the loss of their family home to a wildfire, etc. So here are some examples of initial responses. You might say, "I'm so sorry you are going through this," or "I'm sorry you were hurt in that way. What happened to you is not your fault. You are not alone. God loves you so very much. Thank you for sharing this information with me. or an affirmation like, "I am really impressed at how resilient you are." Other examples, you might say, "It's understandable that you're having a hard time," or "You deserve help in dealing with something so difficult." "Would you like me to connect you with someone who can talk with you further about this?" And I love that on this campus we can ask this one, "Would you like me to pray with you?" Be assured that whatever you say, if you are being supportive and compassionate in your response to student disclosures, you can effectively reduce trauma survivors' isolation, their anxiety, their feelings of stigma, as well as improve their well-being and significantly aid their healing and recovery processes. Now, let's imagine that you have just responded well to a student's disclosure of trauma. Great job! So now what? So the first step, while you're still with the student, is to refer them to many on-campus resources, whatever seems appropriate to their situation, that are available to address their needs in more depth. So some of these include the Health Center, Counseling and Psychological Services, CAPS, student success coaches, their resident assistant or resident director, student life, etc. If your conversation with the student included any alleged or suspected abuse or neglect of a child under age 18, occurring on campus, in college programs, or at college events, then you are required by law to report that to Child Protective Services or the Santa Barbara County Sheriff's Office within 24 hours. So again, that's with minors under 18 who have experienced or alleged or suspected abuse or neglect on campus, in college programs, or college events. So you have to report to Child Protective Services or the Santa Barbara County Sheriff's Office within 24 hours. If the suspected abuse or neglect of a minor occurred in another context, so for example, a student might disclose to you that the victim is actually their younger sibling at home, then depending on whether or not you're a mandated reporter in general, you may not have a legal obligation to report this, but you are likely to feel an ethical obligation to do so, and I would encourage you to report. As a social worker, I'm a mandated reporter in every setting. But when in doubt, some of the people you could consult with on this are Edie Schultze or Stu Kleek. If your conversation with the student included the disclosure of any behaviors related to Title IX or bias, harassment, or discrimination reporting, then the next step is to contact our campus's Title IX coordinator, Edie Schultze, within 24 hours. You can do that via email, phone, or the online reporting form. Now, regardless of whether the student's disclosure gives you some sort of legal or ethical obligation to report it, an important next step is to make a care report regarding the student. This helps to set in motion a series of supports where the student care team can provide that student with various things that she or he may need. So next, in the next day or two, I'd recommend following up with the student. Ask how they're doing, let them know that you continue to care about them, are praying for them, and that you're available as a source of support. Finally, if you're unsure of how to proceed, contact CAPS, Edie Schultze, or Stu Kleek for consultation. So those are our next steps. The final portion of this workshop focuses on your well-being as someone who may occasionally, or perhaps more frequently than that, listen to students' disclosures of trauma and adversity. So researchers in several fields have clearly demonstrated that trauma affects not only the individual victims, but also those who assist them. Think of it as trauma kind of rubbing off on those of us who interact with the trauma survivor, especially when we're listening to their trauma narratives. There's several terms frequently used in the research literature to explain this phenomenon. These include vicarious trauma, secondary traumatic stress, and compassion fatigue. What all of these terms refer to is the fact that working with trauma survivors and victims of trauma can have negative physical, emotional, psychological, and spiritual effects on those who are trying to assist them. So on us in this room. Many of the symptoms mirror that of PTSD, post-traumatic stress disorder. So that includes things like heightened reactions, hypervigilance, avoidance of situations related to the trauma narrative, loss of interest in activities, anxiety, sleep disturbances, intrusive thoughts, irritation, emotional detachment, and depressed mood. Other symptoms can include negative shifts in how we view the world, as well as feeling too fatigued to be a support to someone else. Thankfully, that is not a required aspect of what you'll experience. It's not a given that you're going to experience vicarious trauma if someone talks to you about the trauma they've experienced. You can significantly reduce the likelihood that you will experience these negative effects by proactively developing and implementing self-care strategies into your life. Self-care can be defined as the practice of taking proactive steps to improve and protect your mental, physical, emotional, and spiritual health and well-being. And as a practice, it's something that takes conscious effort to build into our daily activities, into our routines. Self-care can include physical activities, such as exercising, eating healthy, getting enough sleep. It can include mental activities, such as reading a book or practicing mindfulness. Social activities, such as catching up with a friend. Spiritual activities, such as praying or writing in a gratitude journal. But self-care is going to look different from person to person. So, for example, part of my self-care routine includes spending time with God before launching into my day in the morning, reading part of a novel each evening before bed, and going for a long run or hike most weekends. Yours may look really different. It might include things like writing poetry, baking bread, hosting friends for a game night, gardening, playing the piano. There's myriad different types of self-care. The point here is that effective self-care activities make you feel grounded, vibrant, refreshed, rejuvenated. If you have not done this before, I urge you to make a list of activities that help you to improve and protect your well-being, and then make it a priority to do at least one of those activities on your list every day. Although there are risks to working closely with trauma survivors, there are often positive effects as well. Research on post-traumatic growth, for example, has demonstrated that it can be experienced vicariously by individuals who have exposure to others' trauma narratives. So just like the negative effects of trauma can rub off on us, the positive effects of potential growth can also be experienced vicariously. Many helping professionals report that working with trauma survivors brings them a sense of fulfillment, meaning, and pleasure. Researchers refer to this as compassion satisfaction. Compassion satisfaction appears to at least partially protect individuals from experiencing symptoms of vicarious trauma. So in conclusion, the high prevalence of trauma behooves all of us to implement trauma-informed care into our professional lives. My hope is that this workshop has helped you to be able to explain what trauma is and its effect on trauma survivors, discuss the 6 guiding principles of trauma-informed care, enact several key do's and avoid the don'ts when it comes to responding to students' trauma disclosures, understand what steps you should take after a student's trauma disclosure, and identify several actions you can take to reduce your risk of vicarious trauma and enhance your well-being. When students disclose their experiences of trauma to you, be assured that you can make a significant and positive difference in their lives. You can promote their recovery and healing processes. It is not just the professionals who have expert training in therapeutic modalities who make a difference. All of us, by treating each other in ways consistent with trauma-informed care, can provide a healing therapeutic environment. So together, by implementing trauma-informed care, we can provide important and life-changing support to our students. Thank you for making time in your schedule today to take that next step and attend this workshop and learn about these topics. Thank you. So at this point, I know some of you may have to go, but I am definitely available to take questions. And if they're more legal in nature, I will also defer to Edie on some of the specific Title IX reporting types of requirements. Does anyone have questions? Yes, Sandy.
Hi, Sarah. I was wondering if you could speak a little bit to kind of patterns of behavior you see in the college age group of trauma survivors. I know like young children present in some ways, and then it feels to me a little bit like it gets masked by, I don't know, the vivaciousness of this age group. So,
Yeah.
Are there patterns of behavior that you can see or things that might be red flags?
Yeah, so I was told to repeat questions for the recording. So the gist of Sandy's question was, are there patterns of behavior and kind of specific ways that trauma manifests in college-age students? Did I get that about right? Yeah, so some of the things I notice most frequently as a professor in the classroom and as an advisor, I'm seeing a lot of student anxiety, depression, students who are emailing me saying, I can't get out of bed. If they've disclosed to me previously that they're going through something right now, they'll often say, regarding what I talked to you before, I can't handle the day that I'm supposed to do. And so, yeah, anxiety, depression, just difficulty with activities of daily living seem to be part of it here. Then students just our trauma survivor students. There's certainly in my classes, they might. Sorry, I'm trying to think on my feet. There might be days. So again, I'm teaching classes on interpersonal violence, introduction to classes that guide them into the helping professions. And there might be topics. If I'm about to show a video clip or discuss in detail child abuse and show images of it, or about to talk about a different type of trauma, sexual assault, other things like that, students may just let me know they need to step outside, or they might just leave and then later email me and go, so about earlier, I kind of need to tell you that I was triggered, and here's why I left your class in the middle of it. So those are some of the biggest ones I'm seeing. I bet that RAs and RDs see a different aspect in kind of living situations that I'm seeing in the classroom and in my office. But I hope that's a little bit, yeah, yes.
Going along with recognizing those symptoms, how would you suggest caring for people who you see that they have trauma symptoms, but they haven't yet disclosed their story to you?
Yeah, okay, so for the recording, kind of what do we do when we're seeing trauma symptoms, but a student has not actually told us that they're a trauma survivor? So I guess with that, consistent with kind of what I said, when someone isn't ready to disclose, or maybe it's that we're not the person that they're most comfortable with disclosing to, that's totally fine. If you are recognizing trauma symptoms in students, definitely I would not encourage people to kind of force them to disclose their story, but I would certainly invite a student. So again, I'm thinking as a faculty member I would reach out either in person or an email and just say, dear so-and-so, I've noticed that you've missed my class a couple of times, and I was hoping to talk with you about strategies on how we can make sure you succeed in my class. And then once I have them in person, be able to, again, I'm not trying to force them to tell me what's going on, but just maybe say in general, adapting to college can be really challenging. Here are some resources that are available to you. If there are larger things going on in your life, here are some, you might want to, the health center or the CAPS is really helpful. Would you like me to help connect you to resources? Would that be something that would be helpful to you? Something like that, but not asking for details about what's going on. Inviting if they would like to talk about it, but more geared toward how can we help them succeed here and get the care they might need. Yes?
Hi, you mentioned talking about traumatic issues in class, and earlier you talked about like collective or historical traumas.
Yeah.
Do you have any advice for teaching collective or historical traumas as like course content when it's the majority of the course? Like how do you manage that?
Okay, so repeating it for the recording, Kaya asked, in courses, in the topics of kind of collective and historical and structural types of traumas, that might be, a course might have a lot of content on that. How do we address those sorts of topics? I think one of the most important things is for all of us to not be afraid of the negative things that have happened in the past and talking about the ways in which, for example, U.S. society has historically has a history of discriminating and oppressive behaviors against certain groups in society, and they've been impacted by these and are still impacted by unjust social policies, by unjust laws, by discriminatory practices. And so naming that these things are real, naming that their effects are real, that they're not over and done with, and that it may be impacting students today in our classrooms, and that those effects, like affirming that those are real experiences, I think is a powerful step in helping people feel comfortable with their own feelings and experiences, backgrounds, etc. So that's my biggest thing, is naming that this is real and that this may be impacting people in this classroom. And then again, where you're seeing people struggling with these topics, then encouraging them to use the resources available here. That's what first comes to mind, Kaya.
Thank you.
Yeah, yes.
Hi, thanks for the talk. My name's Rob Hughes. I'm the campus physician.
Great.
And so I'm a mandated reporter. My experience, especially if I'm notifying patients of my mandated reporting duty, is that it tends to cause them to kind of clam up.
Yeah.
So I'm wondering if you have any tips on how to notify them early on, but in a way that will make them still feel like they can share reportable details.
Yeah, so great question, repeating that here. So there's a few of us on campus, and it might be some of you as well, who are mandated reporters. We're talking about child abuse, elder abuse, suicidality, homicidality. And so, first of all, in those conversations, like making sure that the student knows early on. So what I might say, if someone is starting to talk to me, I'm a social worker, I have mandated reporter requirements. I just might say, I just want to pause one moment. I really appreciate that you've initiated this conversation. I just want to let you know briefly that I am a mandated reporter, and I list off kind of the topics. I'm also a Title IX. I have Title IX reporting obligations regarding bias, harassment, discrimination, list that off. And I say, there are people on campus who are not mandated reporters who, if you would be more comfortable talking about your experiences with them, the campus pastor's office is one of those sources. CAPS, I believe, is also confidential no matter what. So I say if those would be settings in which you'd rather have this conversation, that is totally fine. We can pause right here. And I try to do it early enough where I don't have the kinds of details that make it already a mandated reporting situation. But let's say that either that moment did not come early enough, they've already sort of sometimes trauma survivors, they just start kind of spilling right away quickly their story, they're just getting something important off their chest, or you give your disclaimer, kind of the I'm a mandated reporter or I'm a reporter of Title IX, and they keep going. Then I make sure that they've already known I'm a mandated reporter, and if someone wants to continue talking after that point, and most people that I have worked with still do continue talking to me about that. It sounds like, Rob, that your experience is that people clam up, and it is completely fine if they decide that each of us is not the person they want to disclose to. There are people on campus that they can talk to who will not have reporting obligations. As with any conversation like this, at that point, once they know you're a reporter, I don't interrupt their narrative very much, even though in my mind I can picture, for example, that CPS reporting form, Child Protective Services form, and how many boxes I'm going to be expected to fill in and how much information they will. And I'm talking about CPS or Santa Barbara Sheriff's Office. They'll wish that I'd asked and had answers to all these questions, but what's best for the survivor in that moment is to tell their story in the way that makes the most sense to them, in a way that flows for them, and not have me kind of mentally asking every question on the form. Was anyone else there? Do you have siblings? And so on and so forth, kind of down the CPS form. Like, just let people talk to you. And again, if they choose not to disclose any further once they hear you're a mandated reporter, don't take it personally, and hopefully they will choose to tell more of their story when they're ready to someone that they feel comfortable with. Those are my thoughts. Yeah.
Thanks so much again. I'm going to echo Rob's thanks for doing this presentation. A lot of us in our roles on campus are problem solvers.
Yeah.
We hear something, we want to fix it right away. And one of the things that I've had to kind of dial back is sometimes, especially talking to people that are in bad situations or just talking, is active listening. Do you have any good active listening resources that could kind of refresh us on how to be a better active listener and not go straight into problem solving mode?
Okay, let me rephrase that for the recording. So Jason's asking about active listening techniques and resources. I think in terms of resources, I'll have to get back to you, and I can potentially.
You mean to put you on the spot?
No, it's fine, and I can potentially get something to Edie for when she emails out the link. In terms of just the things that I briefly went over here, so I teach kind of classes that are basically intro to social work practice, things like that, and a lot of the things. So we all know when we've been in conversations with our loved ones when they're not quite paying attention. They might have their cell phone out. They're looking to the side. They might look at their watch a little too often. Like the kinds of things that make you feel like you're not being heard when you're talking about something close to your heart, something that's important to you. Those are the types of things we need to avoid when we are trying to be good active listeners. Some of the good things. So things that you do when you have had that satisfying conversation with a partner, a loved one, a family member, a friend, where you feel like two souls connected. Those are the sorts of things that make for good active listening. It's usually you've got good eye contact. You've got those empathetic kind of facial features. You might, I would not necessarily do this with a student, but reach out and touch someone for a second, and I hear you. Facial gestures, open body posture, so it's not closed arms and crossed legs and looking off into space. It's really just expressing kind of every aspect of our physical bodies that I am listening. Our tone of voice. Often when we're listening well, we might say things like, I hear you, oh my goodness, yes. Kind of those reaffirming little phrases that don't interrupt the flow of what someone's saying, but kind of let them know I'm right here with you. Like those are some really good active listening techniques. And I can look into if there's like a resource that lists those, but that's what comes to mind when I teach about these topics. And when I interview people, those are things I'm trying to do as well in my research.
question about, this may be for Edie, but if a student is reporting the act and it's from another country,
Oh.
and the crime or the activity that was being reported to you is maybe sexual activity or something else, but it happened in another country, not in the United States, how would they be in the reporting or process of the reporting in that aspect?
Can I repeat the question? No.
Yeah, so repeating the question, so the question was about if a disclosure about trauma or abuse occurred in another context, specifically another country. Now what? So, yeah, Edie.
It would depend. For the first question, I would want to know is, did it happen on a Westmont-oriented or Westmont-managed program? Because that would make a difference. We have some obligations under California law to, if it was a sexual assault, some kind of bias incident, we have expectations from California, legal obligations to investigate as we would if it was on campus. If it was unrelated to Westmont, I think what I would do is I would work with our attorney to find out what our obligations are, our external counsel. Jason is a trained attorney, so he would probably help us work that through to see what our obligations are. I think I would want to work directly with the individual to find out what they have already, if anything, set in motion in their own context. It would be a tricky one to try and navigate that in another country if it was an uncooperative or unwilling victim of something or survivor of something. But we would work with it on kind of a case-by-case basis, depending on where it happened. But if it was a Westmont-managed program, we would definitely have a responsibility to do that. Good question, Chris.
There's probably time for one more short question, if anyone has one. Yeah, great. Yes.
I'm just curious, is there a percentage of the students who may have grown up in the juvenile system, like for criminal activity, or maybe in the past been a sex offender, and now they're in the campus? Is that something that's disclosed to anybody, or do they keep that all quiet if it's a person who's gone through that type where they were actually the ones causing pain on others because of the trauma they had?
So repeating the question is, are there circumstances here on campus where the perpetrator of a crime is here as a student, and is that information disclosed in some way? And I don't know the answer to that, so I will defer as well.
Well, I'm looking at Mike McInnes, and maybe Mike has a response to that as the director of admissions. In the time that I have worked at Westmont, I'm trying to think if I have been aware that a student has been on the sex offender list. It has happened at other schools where I've been, and it has usually been different states. Information was provided at their admissions. Mike, do you have a response? If you say it, I'll repeat it.
Yeah, we used to ask in the application process whether a student had any kind of criminal background, but we're no longer legally allowed to ask that question in California.
So in California, in our admissions office used to ask the question, but we are no longer legally allowed to ask the question.
They might self-disclose.
Yep.
I can add one thing.
We can't necessarily.
Also, registrants, so those are individuals on the sex offender registry. Registrants have reporting requirements wherever they go. So if they're in compliance with reporting requirements, they would be letting the college know in some way, shape, or form. Okay.
Well, let's thank Dr. Sarah Jirek. Really well done. Really well done. Again, you can see why I really value Sarah's expertise, but also her demeanor and the manner in which she teaches and conducts her work. I will send a follow-up email to all faculty and staff with the slides as well as the resource on active listening and a link to the recording. Thank you very much for coming. Let me know if you have questions. Have a great rest of your day. Thank you.